Addiction, a word that conjures up images of dark alleys, desperate cravings, and self-destruction. But what exactly is addiction, and how does it take hold of our minds and bodies? In this video, we'll explore the fascinating psychology of addiction, from its roots to its remedies. Firstly, let's define addiction. At its core, addiction is a chronic disease that affects the brain's reward and motivation systems. It's a complex interplay of genetics, environment, and behavior that leads to compulsive substance use despite the negative consequences. But how do addictions form in the first place? Well, it all starts with the brain's pleasure center. When we engage in pleasurable activities such as eating, drinking, or socializing, our brains release dopamine, a chemical that makes us feel good. Over time, the brain starts to associate certain stimuli with that dopamine rush, creating powerful neural pathways that reinforce the behavior. Now, let's throw substances like drugs or alcohol into the mix. These substances hijack the brain's reward system, flooding it with dopamine and creating an even stronger association between the substance and pleasure. This is where things start to get dangerous. As the addiction takes hold, the brain starts to prioritize the substance over other pleasures and even basic survival needs. So, how can we overcome addiction? It's a complex process that involves a combination of medical, psychological, and social support. Let's take a look at some of the common approaches to addiction recovery. Firstly, medical interventions such as medication-assisted therapy, MAT, can be used to manage withdrawal symptoms and cravings. For instance, medications like methadone or buprenorphine can help alleviate the symptoms of opioid withdrawal, while nicotine replacement therapy, NRT, can be used to ease the cravings associated with nicotine addiction. Psychological interventions, such as cognitive behavioral therapy, CBT, or motivational interviewing, can help individuals identify and change the thoughts and behaviors that contribute to their addiction. For example, CBT can help individuals develop coping mechanisms for stress or triggers, while motivational interviewing can help them find intrinsic motivation to change their behavior. Social support is also crucial for addiction recovery. This can include joining support groups like Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, which provide a sense of community and accountability. Family therapy or couples therapy can also help repair relationships that may have been strained by addiction. Now let's take a look at a real-life example of addiction and recovery: the story of Dax Shepard. The actor and comedian struggled with addiction to alcohol and drugs for years before seeking help. He's been open about his journey to recovery, which involved therapy, AA meetings, and the support of his family and friends. He's now been sober for over a decade and continues to advocate for addiction, awareness, and treatment. In conclusion, addiction is a complex disease that affects millions of people worldwide. By understanding the psychology behind addiction and the various approaches to recovery, we can better support ourselves and those around us who may be struggling. Remember, recovery is possible, and every journey starts with a single step.